For you, Gideon, would it be the pricing module that you use for your community? Would you describe that as your corporate social responsibility, or you have an intentional corporate social responsibility that you embark on you want to tell me about?
Yes, the pricing model, not necessarily our corporate social responsibility. We have clearly defined activities that we consider as corporate social responsibility, which I will talk about briefly. Currently, what we are doing is that we are embarking on preventive healthcare, doing a massive health screening in Ashama. Every corner of Ashama, we are targeting at least 50,000 adults. Yes.
Wow.
So what we are doing the BP screening, we are doing the kidney-related screening, we are doing body mass index, so that what we believe is that if you were to do early detection, we don't end up promoting very sick people, because when they come in a state of emergency, your chance of living is very slim. So we started 5 weeks ago. We are screening as many as we can, just to ensure that Ashama people, they are living a healthy life. Just as last week, our MC visited one of the screening centers. And when we spoke with the doctors on site, one of the things they made us to understand is that one of the things they are picking up from the screening center is that we have a lot of people with high blood pressure.
Okay.
And it's unfortunate that this is coming. And some of them too are living in denials.
That they don't have high blood pressure?
Some of them, according to their doctors, they have been told, but they are not taking their medication. They believe that, I don't know who convinced them to believe that if they don't take it and they take it out of their mind, they will be well. That is a denial state.
Okay.
So we have to find a way to convince them. Now that you know, be on medication, you live a normal life.
Yeah.
So
are these permanent screening centers, or they're temporal?
They are temporal.
Okay.
Because we want to cover every corner of Ashama. Normally, within a zonal council area, we spend about 4 weeks.
Okay.
Initially, we were doing once in a week, but we noticed that it was not enough. So we are extending it to 3-4 days, so that we can be able to take more people. Yes. One of the good things the government is doing to augment their screening is that the government is also providing vaccination for the prevention of cervical cancer.
Okay.
I'm told that the value of the vaccine is 3,000, and the government is doing it through Ashama Health Directorate, screening, vaccinating children below 13 years, and also doing TB screening as well.
Okay.
Which government, we need to commend government about it, just to enhance and to encourage the Ashama people to take this screening very serious. In addition to our corporate social responsibility we are doing, in the month of May and June, we are doing free surgery for those with ankle and foot deformities.
In the month of, this month of May?
Yeah, this month.
Right?
This month we are doing the screening.
Okay.
And the month of June, we are doing the surgery itself.
Oh.
As at last week, we have screened a little over 100.
Okay.
Yes, but though we have screened 100, it's not all the 100 we are going to do the surgery. The surgeons are doing the determination, the number of people they are going to do the surgery. And each surgery, the minimum cost of the surgery is not less than 25,000. And we are doing these surgeries for free. It is something that we do every year.
Abednego, this is a huge project by the company, but subsequently, do you have plans of doing other things? What are the plans for the hospital subsequently?
Okay. So as a growing company, we want to make healthcare very accessible and efficient for our valued clients and then stakeholders that we work with. So management is investing more into enhancing our capacity. So just recently, we've done a refurbishment of all our branches where we have new equipment that we've brought from abroad to augment the kind of service we provide for our patients. And just recently, we had a CT scan. We've also had a dialysis unit at our Tema branch that is helping us to take good care of our patients. And we are also investing in human resource. So on daily and monthly basis, our employees are being trained, both clinical and non-clinical staff, so that we'll be able to provide the best of care to our stakeholders. And one unique thing about New Crystal is that we working and we have a good relationship with the National Health Insurance Authority. So we are one of the few private hospitals that accept NHIS card.
Okay.
So NHIS cards, if you come to our facility, it covers your consultation, your laboratory investigations, and your medications are also served free under NHIS. So New Crystal, we really want to make healthcare so accessible because we believe that most of the deaths that we see or we experience on daily basis in our countries are issues that we could help resolve and prevent. So we want to assure our stakeholders that we are open for their feedback, and management is really investing to make the care and the experience so great for them.
That's really nice. You are very pleasant at your company. Yes.
Abel left out something.
Okay.
On every year, what we also do, in addition to what Abel said, we sponsors at least 5 needy but brilliant students. Every year, from primary to the university.
Okay.
If my memory serves me right, at least we're able to produce about 5 doctors sponsored by New Crystal.
Okay.
But the other terms of condition is that we don't open the doors for people to apply. We go out, we fish out, and we do this. But for the record, if you, some of our health service managers, they are all New Crystal sponsors. Some of them today are not even staff. They get their sponsorship and they go their way and go and benefit. So those are some of the other investment capacity building we are investing.
We definitely are happy to tell the story of New Crystal Hospital, especially because you've partnered with us on the Impact Makers journey. Thank you so much. Can we hear the details where we can find you? You already told us the branches, but you have social media following and all of that. How can we locate you easily?
Okay, so just before that, we want to thank our CEO, Dr. Wilson Amagbeto, for the great initiative and the investment he's making and the drive he's giving us. I want to thank management and all staff of New Crystal Hospital for the great effort we are putting into serving Mother Ghana. Now, New Crystal Hospital, we are on all the social media platforms. On Facebook, we are New Crystal Group, IG New Crystal Group, X New Crystal Group. On LinkedIn, we are also New Crystal Group. So TikTok New Crystal Group, and then you can follow our pages for all the exciting updates about health-related issues. And then you can also reach us on the MTN to free number 0800-180-260. I take the number again, 0800-180-260. Or you can also reach us on the MTN number 054-4347-239.
Okay. Gidel and Abednego, definitely you're going to be my friends once you're in Impact Makers. I'm excited to have you on board. And thank you so much and wish you all the best. We shall be visiting soon.